Shearing applied force extraction of lenticule by reverse pull with wow factor in refractive lenticule extraction. There is no financial interest in this video. Sometimes going in the reverse direction is beneficial. Femto laser makes 4 cuts. The first cut is a posterior lenticular cut, as you can see in profile view also. Then it makes the second cut, which is a side cut of the lenticule, which moves 360 degree vertically. Third cut is anterior lenticular cut, which goes beyond the posterior cut for better dissection. Fourth cut is incision taken at 110 degrees. As you can see in profile, the incision cut is seen. Laser makes tissue separation by series of air bubbles. This is the posterior cut. Energy is kept moderate, 150 nanojoules. First cut starts from periphery to center, and anterior cut starts from center to periphery. We are presenting a simple technique with better results. The need of less inflammation and early visual recovery. Strategic dissection is done for the optimal results. You create initial pockets anterior and posterior to the lenticule. This is the anterior initial pocket, and this is the posterior initial pocket. So further dissection is easier. We are going anterior to the lenticule now. While going posterior to the lenticule, we do a swiping motion so that posterior lenticule is separated well. Now we go obliquely away from the posterior pocket to the opposite side, dissect left and right half, then separate central 3 mm area behind the lenticule, separate 180 degree away from the incision, then paracentral quadrant is separated and only right paracentral quadrant is kept attached and removed last by using safe technology. This is very safe and predictable technique with minimal time required for the removal of the lenticule. The stoma around is not manipulated much. As you can see, we are going oblique away from the posterior pocket, go to the opposite end of the wound and dissect about 30 degree area to create a track from the incision to the opposite end. Then slowly we dissect above the lenticule in an anterior pocket. First we do the left half of the incision, then we do the right half of the incision. An anterior pocket is now completely separated. While going behind the lenticule, we depress the instrument so we enter into the right plane. Then we dissect central 3 to 4 mm area to create a potential space and the separation doesn't become haphazard. Now we bake through the lenticule opposite wound for about 180 degree. This brings the lenticule towards the incision. Then we separate the left para-incisional quadrant. So now only right paracentral quadrant remains attached. We keep it attached because that gives a control, and we remove the lenticule by safe technology. Check lenticule 360 degree, inspect for any tears. To get a wow factor, you should have a less inflammation and early visual recovery. Do adequate hydration. Use lenticular pressurized dissection, that is whenever you are separating the tissue, press onto the lenticule for separation, so surrounding tissue is not disturbed. That gives early visual recovery. Do stomal massage vertically and horizontally. Milk out the BSS injected inside the wound. This apposes the tissue quite well. Operate under high magnification for better tissue separation. And as you can see at the end of the surgery, on table, on a slit lamp, cornea is seen crystal clear. This is the immediate post-op picture. And day 1, cornea is also seen more pristine, clear, with a vision of 20 by 20 in more than 95% of the patients. This technique is effective even in complicated cases like opaque air bubble. You can see left upper opaque air bubble. Do separation very gently. Remove left paracentral area by safe technology where air bubble was there. You can see black areas surrounding the central part showing inadequate energy or missing energy. While dissecting, take care that you are going along the plane of the lenticule to avoid tearing of the tissue. And once you do that, remove the tissue by safe technology. In conclusion, use safe technology, lenticular pressurized dissection, high magnification, adequate hydration, and stomal massage. Now, relax. Because it gives a wow factor. And smile. Because it's safe. Shearing applied force extraction of lenticular by reverse pulling of lenticule. Thank you.